current understanding of gum disease is what we call a chronic immunoinflammatory condition, and I'm going to break that down. So the way I typically explain it is the splinter in the skin analogy. So when we're busy people, if you get a splinter in the skin, sometimes we don't even know it's there. The problem with a lot of chronic conditions is they're frequently either low pain or they're painless. That doesn't mean the disease is not occurring. So frequently, despite the fact we don't know it's there, the disease is slowly ticking over and developing. Then we come to the inflammatory component. Now, inflammation is your body's generic response to things it just doesn't like. So with the splinter, after a period of time, you'll see the redness, the heat, the swelling. So we see that, swelling, pain, and dysfunction. And what your body's doing during that process is it's trying to seal off the splinter and getting ready to expel it out of your skin. And in your skin, that works really, really well. The problem with your mouth is it's very, very unique. The teeth are the only part of your body that don't have a shedding capability. So when plaque and calcareous debris becomes fixated on the tooth, the body goes, oh dear, I can't get rid of this. So it shifts that focus down to the roots of the teeth. So then you start getting this inflammatory process around the roots of the teeth. And what does the body do? It's trying to get rid of the plaque and calculus. So it's dissolving the bone in preparation to try and make you lose the tooth. Because if the tooth goes, all the plaque and calculus on that tooth goes with it. Now that's only half the equation. We always talk about this idea of plaque versus the person, or the immune system. Why do some people suffer from this condition so much more than others? And this is where we start exploring a patient's background. Systemic factors, genetics, smoking, diabetes, obesity, all these factors that are affecting the patient's response to gum disease. So one of the things we're trying to do with gum disease is twofold. A, we're trying to eliminate the plaque, which is the primary threat. That's the obvious cause, because we know if we could get rid of all the plaque in the world, the disease would stop. But the problem is plaque isn't everything. Food, drink, you name it. So unless you want to stop eating and drinking, you're going to have a problem. The other side of the coin is we're also trying to stimulate the body. We're trying to get people to A, improve their oral hygiene so they can keep the plaque at bay, and maybe try and find any other mechanisms we can to try and stimulate a body's response to give us the best healing response possible. So that when we move the debris, the body can kick in, heal up, and then we can restore someone to what we'd call a state of health. And basically our mechanisms are all targeted about trying to get the body towards a state of health. On the most recent studies, we used to think maybe it was 1 in 3. They did a really good study by the NHNES over in the USA, which basically said, no, it's actually almost 1 in 2. The only way you can either really pick up on gum disease is A, if you see the obvious signs of inflammation in teeth, such as bleeding when you brush your teeth or stimulation, or potentially if you're visiting a dentist and they're smart enough to pick up the probe, or you have what we would call a dedicated event. This could be an abscess, this could be pain, this could be loss of a tooth, any number of events. But the reality is it's either going to be the obvious signs of inflammation, or your dentist is going to say you are showing signs of gum disease, or what we typically call periodontal disease. The first thing is you want to treat disease for the sake of treating disease. There are multiple benefits. So in the mouth alone, if you want to maintain a smile, have a quality of life, eat, drink, and be merry, you want to hang on to your teeth. That's going to be a significant challenge. Obviously, we don't want a disease that's going to lead to you losing your teeth. But now the systemic effects are so much even more pronounced. We know it affects everything in your body. Everything from, neurological diseases, cardiovascular diseases, all sorts of other diseases. We're now seeing such strong associations between periodontal disease and systemic diseases. We know that if we can treat the gum disease, we're also going to contribute to not just good oral health and keeping your teeth, but we're also going to contribute to good systemic health. And anything that improves someone's quality of life and state of health has to be a good thing.